like to introduce you and welcome you to today's Cutter Transportation webcast. I would like to, before we turn it over to our presenter today, I would like to tell you a little bit more about Ms. Siwan Zhang. Siwan has a strong commitment to empirical research and practice in traffic safety, including traffic injury prevention for vulnerable road users. Her areas of interest include theory-based behavior change and behavioral safety program development and evaluations. She has been involved in designing safety education materials for various target populations and is currently working on behavioral safety program development and evaluations for motorcyclists in Florida and development of a community-based Healthy Buddy program for transportation disadvantaged adults. Dr. Zhang has taught a variety of public health courses at the University of South Florida and serves as a journal reviewer for several academic journals. With that being said, I am going to hand the presentation over to Siwan. Siwan, are you there?
Yes, I'm here.
Okay, take it away.
Yep. Thank you for the introduction, Stephanie. My name is Siwon Jang again. I'm a research associate and faculty member at the Center for Urban Transportation Research, Qatar, at the University of South Florida. Today, I want to introduce the Healthy Body program, which is one of our community-based initiatives to address older adults' immobility issues. So this webinar's title is Addressing Immobility in Transportation Disadvantaged Older Adults through a Community-Based Initiative. The U.S. Census Bureau predicts that by 2035, older adults will outnumber children for the first time in U.S. history. Also, research shows that older adults experience the greatest transportation disadvantages compared to younger age groups. Also, as we know, there is growing population of older adults who will eventually lose the ability to drive, and their driving cessation may exacerbate their health conditions. So, under the mission that we want to improve older adults' health and well-being through community support and increased mobility, our team developed a buddy program that pairs older adults who are in need of transportation and college students who seek volunteer opportunities to fulfill their course requirement. So the buddy program does not provide or arrange rides for seniors, but we wanted to have trained student buddies for them to help out the seniors in the community who are in need of transportation because they do not drive anymore. Especially the resources and information we wanted to provide was about available transportation resources for their medical trips and transportation resources for their daily life activities. Also, we wanted to provide some available information to access local health and well-being resources. So the buddy program idea was selected for funding by CTEC, Center for Transportation, Environment, and Community Health. And the phase one, the program development and testing of the website was implemented in 2018. So when we started working on the project, we checked if there was any similar type of program before. And we found out that the Winter Park Health Foundation's buddy program, they had some similar format of the Healthy Buddy program that we were thinking. Also, they reported that the program was mutually beneficial for both seniors and volunteer students. This is the overview of phase one of the Healthy Buddy project. We started with some literature review and community resource assessment to compile local transportation and health resources for older adults. Based on that, we did some needs assessment of older adults, conducting qualitative in-depth interviews with 14 older adults. And we had a lot of community partner meetings. They include community senior centers, transit agencies, and USF faculty members who teach those courses that require some volunteer hours. So after that, we did some material development, which includes some compiled resources we figured out. And we really made ample efforts to develop volunteer training materials. So finally, we were able to make a website for the program, which is located at hbuddy, buddy.org, hbuddy.org. We especially wanted to provide a personalized profile template for each older adult participant so that they can view their own page, which includes the necessary information that they figured out working with the student volunteers. So first step was literature review, and we found out that for over age 65, majority of them, they plan to age in place, meaning that they want to be remained in their own home, not moving out to other places, including like assisted living or retirement community. They do not plan it, meaning that they want to be in their own place. So they will need some type of transportation to live their daily lives. Also, about 20% of the people over age 65, they do not drive anymore. One study conducted in 2016, they found out that about a half of the non-driving older adults, they were not aware of available resources in their community for their transportation use. In terms of the driving cessation, it is associated with social isolation and decreased life satisfaction, declines in physical, social, and cognitive function, and some mental issues, including depression. So next step was community resource assessment. We contacted over 30 agencies in Hillsborough County in Florida, our target county. So we were able to compile local health and transportation resources available for older adults specifically. So we met with transportation agencies, step members, in county senior center, step managers, and some health education agencies. So based on the information we compiled, we conducted in-depth qualitative interviews with a total of 14 older adults who do not drive but still in need of transportation. So the recruitment was done through Hillsborough County Senior Centers. So we wanted to introduce our program concept and the website draft to figure out how they feel about the program and the website. And we wanted to discuss what health and transportation needs they have. All the interviews were recorded and transcribed with software, and we refer to the BRFSS data, like Behavior Risk Factor Surveillance System data, because we wanted to check the common chronic health conditions or diseases our target population has. They are on the same page with the national data. So here is the needs assessment findings. For the 14 interview participants for their day-to-day transportation, half of them said they rely on family and friends for their transportation, and half of them rely on public bus system. For their medical trips, about 30% of respondents, they said they are relying relying on their insurance. And 21% said they rely on family and friends for their medical trips. And another 21% they said they are relying on private transportation for their medical trips. Here is another key findings. Among the participants we interviewed, less than half were open to using public transit. When we asked the reasons, they mentioned that the bus stop is too far from their places, or it's not available the neighborhood in their neighborhood. Also, some said they think public transit is dangerous to use, but most were open to using private transportation, but they still expressed some difficulties to use them because of its price. Also, but interestingly, they were positive about the ride-share program like Uber and Lyft if they have used them before. Here is another findings. The most of the participants, they thought the information we had in the website, it would be helpful for them to resolve their transportation issues. Also, more than half, they said the website was easy to navigate by themselves. We also got some feedback about the website. They wanted more larger font size for the website, and they wanted us to add more information on other social services like food bank or some alert for natural disaster emergency information. Also, we found out that about half of the participants, they were not able to use the computer because they do not have it. But we knew that the senior centers, our study sites, they have their own computers available for seniors. So in the program overview chart, the third step was program material development. So based on the needs assessment finding, the program website was finalized, and we developed some training materials for our student volunteers, which includes training presentation, workshop activities, volunteer handbook, and session guide. This is the program website. A pilot website was created based on the needs assessment, and we tested the website with our interview participants, and they think the website is just doable. The program is feasible for them. So, but one important thing we found out was we need paper version for their personalized page for people who do not have access to computer. So we added a function for printable version of the page so that the seniors could have both like website and the printed materials. Also, we wanted to have some function that they could add some information in their own website without the healthy body, the student body. Also, if the student volunteer agrees, they can interface with each other in the website, the personalized web page. So in the volunteer training presentation, we included overview of program concept and structure. And the presentation covers some requirements for student volunteers. This was more complicated we expected because the USF IRB required a type of certificate for them to work with the older adults at senior centers. And the county, Hillsborough County, required us to go through the background check. Also, there are other some like volunteer responsibility to complete the program. they are required to do at least 2 sessions, session 1 and 2, and they can continue more sessions if both parties, like student volunteer and the older adult body, they both agree they can continue the sessions. Also, the presentation covers some website functions for the student volunteers to familiar with the structure and the personalized website as well. And we wanted to emphasize how to work with older adults. Be, yep, because based on our team's experience working with the older adults population, sometimes participants they get easily upset by a specific question. Also, they kind of become easily distracted during the interviews and sessions. So we wanted to be specific as much as we can so that the student volunteers can be prepared for working with their older adult buddies. So this is the cover page of volunteer handbook. So handbook includes the almost the same information we provided during the presentation, but it has more detailed information about the study protocol, volunteer standards, and our program's mission, benefits, and some more detailed information to work with their older adult buddies. This is the session guide, the last material to share with you for phase 1. Session guide is a quick reference for student buddies to bring with them to sessions with their older adult buddies. This is kind of reminder of the contents covered in the presentation, the in-person workshop. Also, it includes some key interview questions and some interview tips to help the student assistant conduct the sessions with their partner, older adult buddies. The phase 1 of the Healthy Body project was done in 2018, and phase 2 was followed with the continuous funding from CTEC. So currently we are finalizing phase 2 at this point, but we wanted to share what we have so far. So phase 2 is for implementation of the Healthy Body program developed in phase 1. So we wanted to understand the impact of the program by providing personalized transportation and health information through the body program and getting older adults participants their personalized transportation and health information through this body program. So we do pre-post surveys to measure the effectiveness of the program. The survey questionnaire includes their ability to access healthcare and daily life activities, their self-efficacy, and overall quality of life. This is the chart showing the phase 2 of the program. So we started with student volunteer recruitment because it required a good amount of time for them to go through all these required training, certificate, background check. So in the meantime, we started recruiting older adult participants through the senior centers. So we did some screening survey to have eligible participants for the program. So once we were ready for both parties, like student volunteers and the older adults, we paired the buddies, and then each pair, each team had a session, the first session, session 1, which is basically needs assessment interview. So with the interview guide, the student buddy and the older adult, they met in the senior center that the senior goes to. And the student body went through the questions, discussing the older adults transportation and health related needs, and their some more information to know better the older adult body. So once the session one is done, they came back to the research team and we sat together reviewing their notes to figure out what available options could be used for that specific older adult body. So we sat together, we arranged all the information available for the body, and we often tested if the listed resources are up to date. So we checked all information is up to date and available, and the student body went back to the uh, older adult body for session two. So at that session two, the student body provided the information we organized for the older adult body's review and got some feedback and finalized all the information for the personalized web page in our website. So the research team helped, assisted with entering the information in the website if needed. So now we are doing the post surveys with our older adult participants, and we did some volunteer feedback survey uh, to see what and how our student volunteers felt about the program and the sessions they had. So we had a total of 11 students from a social work course at USF. They had some volunteer requirements. So the course instructor, we and the research team, we closely worked together. Based on the interviews in the first sessions, students recommended some relevant resources for their health, the older adult bodies. So again, we reviewed the available options together, compiled the information, and we were able to have some travel training step from one of the community transit agencies. So they just came over to the center and help us work with our older adults population. It helped a lot. And again, we are currently distributing post surveys. So this is just preliminary findings from our pre-surveys only. So a total of 62 older adults participants were there, 31 for the intervention group, 31 for the control group. They were in in different senior centers. And to be eligible for participation in the program, you must be 65 or older, and you do not have regular access to transportation for your daily lives, and you have at least one chronic health condition you need to manage. And if you have dementia diagnosis by medical personnel, you cannot be in the program. So participant demographics, 76% they were female, and 92% were single, and 82% of them they were like low income, and half of participants were Hispanic. So more than half had a high school degree or less. 63% of the participants said they were not able to drive, and 42% they said they never used any private transportation services. Half of the participants said they use door-to-door services frequently, which includes the Heart Sunshine Line, Heart Plus, our local door-to-door transportation services. Also, many participants said they just rely on children or relatives for rides whenever they need them, and they use public services too. And mostly, it was interesting to see, to learn that they are familiar with Medicaid paid transportation methods. So they responded that in the past 6 weeks, almost half of them, they did not have transportation for shopping or similar events. And over a quarter of the participants, the respondents, were unable to travel to a medical or dental appointment. So these are the lessons we learned from the implementation phase 2 so far. We learned that the recruitment of student volunteers needs to be done as early as possible. Also, we want to closely work with the courses that require volunteer work where possible because of that type of obligation, students were more motivated than some students who did not need to fulfill that type of requirement for their own courses. Also, we now know we need plenty of time for IRB certificate and background checks, as well as our own training. And we want to include some workshop for IRB in training because in this phase, they were undergraduate students, and most of them, they were not familiar with USF IRB system. So it took longer time for us to assist with their IRB certificate. So we thought if we had a separate training time for the students, we should have reduced the time that took for the clearance of all these required IRB certificates. Also, it would be desirable if you can set some like certain schedule with your senior centers ahead of time. So for example, because based on our experience, the senior centers, they have their own routine and events, the yearly event plan. So if you can, you just work with them to figure out the best day for them to have the research team, the student buddies. Uh, yep, the recruitment flyer is for the student recruitment. So currently, we are finishing the collection of post-survey data, and we are going to do some statistical tests to see the effectiveness of the program. Also, we are going to submit the report to the funding agency, CTEC, and share the findings with the stakeholders and publish findings. And fortunately, we were able to secure another funding to implement Spanish version of the Healthy Body program because, as you might recall, the half of the participants of phase 2, they were Spanish-speaking older adults. Also, geographically, the study location was having a lot of Spanish-speaking older adults. So we submitted our idea, and we got a letter that they can support the next phase, phase 3, for the Spanish language healthy body program. So we are planning to start the program from summer 2020, and we will be able to recruit bilingual student volunteers and identify relevant Spanish language accessible resources. These are our new homework for phase 3. That's it,
Okay,
Stephanie.
C1. Okay, okay, C1. Thank you so much for the informative presentation. I did want to sort of go through some of the questions that came in
Mhm.
while you were speaking, and I just would like to remind everybody that the Q&A box is located in the bottom right-hand corner of your screen. If you would type any questions and or comments, that you have. We will submit and read those out loud. So C1, the first question comes in and says, will other materials, so as you work through stages or phases 2 and 3, will the other materials be available to start these types of programs in their areas?
What other, let me see. Mm, so when you say other materials, other than these materials that I just shared?
Yeah, I believe just the materials that you were talking about and sharing.
Yeah, we
Flyers
would be
and the
happy to
training
share them.
materials, those kinds of things.
Yep, yep.
Yeah. Okay. The next question comes in and says, what is the commitment for the student volunteers, the time commitment? How
They
much
were
time do you have to
required
spend
to, yeah,
a
they
year?
were required to like do 20 hours in total to fulfill their course requirement.
Okay.
So all the training time, um, meeting time with the research team, the time they used for background check, IRB certificate, all these time commitments were counted for their volunteer hours for the course.
And then what type of costs does the funding support for the program?
That's a good question. Ah, mm, hold on. Stephanie, I'm looking at the Q&A chat.
Okay.
Are you covering those questions?
Yes, I am. Yes, I'm going through them.
So what is this question? Where is it? Is it from Anya?
Yeah, yes.
Okay.
And SC1 is
Uh,
reading. Yeah.
basically, they paid the research team's labor hours, basically, and we did some compensation too for the older adults' participation. We provided $10 gift card for pre-survey, a $15 gift card for their post-survey completion. Also, we were able to reimburse the student body's travel, but I think a limited number of students claimed the travel reimbursement because the money is not that big.
Okay. And then the next question comes in and says, do you have plans on where you're going to a good place to recruit your Spanish only older adults? Will you also recruit from senior centers?
Let's see. Yes, because the needs of the Spanish version was brought up from a couple of senior centers in Hillsborough County. Interestingly, when we went out for the program sessions, we need translators because majority of the seniors in a couple of specific senior centers, they were just Spanish speaking only. So we already have a good partners to work with for the Spanish version of the program.
Okay. How is the cost of Uber, Lyft, and taxis? How is the cost of Uber, Lyft, and taxi cover since a number of the older adults lack the financial resources?
It seems like they rely on some like government government, how can I say, like social security money. So they had very limited income and they have used them for their rideshare use, but they were firm that these options were too expensive for them to use.
Okay. And then the second, so this is sort of like a follow-up question to the recruitment from the senior centers. What
Mhm.
about adults? Was there any outreach done to older adults who are just homebound seniors?
Not yet,
Not yet.
because it was not easy to recruit and work with them because, first of all, USFIRB was they were really careful for sending our students out of campus. So they wanted us to secure a safe place to have students and the seniors for the research. So we've not tried any homebound seniors yet, but in the future, yes, we are interested in expanding our target to like a larger group of older adults who are in need of transportation.
Okay. I'm reading through some of these other questions. Hold on. I'm having a technical challenge over here.
So that's why I wanted to kind of help, like reading through the questions, but this is not easy, Stephanie.
Yeah, I don't know what's
We are
going
good.
on. Okay. Let me delete that. Actually, hold on once. Yeah, I'm having my challenges. I'm having some technical challenges here, so I do apologize. Will there be any opportunity for your research to address the possibility of shared mobility such as Uber, Lyft, and on-demand microtransit to their
Uh, I'm personally interested in those options for seniors. So, but at this point, unless because currently we are kind of transportation disadvantaged, including some low income. Mostly they are low income. So, as far as they are saying these options are pricey, I don't think we get to work on these options, the rideshare programs, in the near future. But I'm personally interested in like researching these options for the current target population. Because, for example, if the government could have some subsidy um, to use these share programs, like give a voucher, like $20 even, that would be helpful because whenever our target needs their own transportation, they can just simply use the voucher, and the ride share system is already there, functioning very well. I'm interested in that option, but for this specific program, I am not sure at this point.
Okay. And then there was just a question here for clarification. It says to clarify, was the purpose of the program to provide public transportation travel buddies? The buddies were not directly providing the transportation, correct?
Correct.
Correct. Then somebody also wanted to know, was there any collaboration with the Safe Mobility for Life program?
Um, Not yet, because I think I introduced the program ideas, and I discussed the ideas with them, like Safe Mobility Coalition, like Gail and other members. They showed great interest, but we just wanted to work on the development and the pilot test phase two, and I wanted to share the findings with the coalition.
Okay.
And
And
I'm planning to attend the meeting next month, I believe. So I will check with them if they are interested in like sharing this information with the coalition members.
okay.
I
And
would be
then
happy to do that.
yeah, and then how did you select the senior centers? Did you just call up and ask if they would be willing to participate in the program?
Yes, we started with that. I just called some closer locations from USF because our students need to travel there. Um, And but I eventually I had to work with the higher ups to receive the kind of endorsement from them. It took longer time. So we've got a letter of support, which includes all the senior centers in the Hillsborough County. So it ended up with a great outcome, but yeah, I started with working with individual senior centers near USF.
Okay. Okay, Siwan, thank you so much for the great presentation. I'm going to open up the evaluation. If it doesn't open for you, the evaluation is provided in the evaluation 2.27.20 in the link section. So if you could just take a moment, again, to complete that evaluation, as the feedback is not only important to Siwan, but the entire transportation webcast series. We do have, oops, the date is incorrect on this slide, and I do apologize. Our next Cutter Transportation webcast is scheduled for 2 weeks from today on March 12th on the topic of increasing the desirability of transit and all other travel choices via the Best Workplace for Commuters program presented by Program Director Phil Winters. Again, thank you so much for attending today's presentation, and we'll see you in 2 weeks. Thank you, Siwan.
Thank you, everybody.